Welcome to the Industrial Athletic Trainers Society Continuing Education Program On-Demand series. We're excited to have you join us and dive into this tailored content created just for you. Whether you're looking to expand your knowledge, sharpen your skills, or stay current with the latest industry insights, you've come to the right place. Our On-Demand series allows you to learn at your own pace, anytime, anywhere. Stick around until the end for important instructions on how to claim your on-demand continuing education credit. Thanks for choosing the Industrial Athletic Trainers Society. Let's get started.
To kick everything off, I wanted to go ahead and introduce Keita here. Thank you so much, Keita, for joining us today and speaking about health and wellness. So for us here, we've got Keita. He is a manager of divisional health and wellness strategy at Delta Airlines. So I think you had a little bit of a rough week, but appreciate you still being here. So thank you. Overseeing wellness initiatives for global operations. With over several years at Delta, he has driven significant improvements in employee health and engagement, optimizing employee experience. And then for education, right, he holds his MBA in healthcare administration from UMass Amherst, a master's in exercise science from Georgia State, and a bachelor's in athletic training from Stony Brook University. Thank you so much for being here today. And I will go ahead and just explain to folks. The comment section is open, and I'll be monitoring that. Feel free to drop anything in there. And then Keita, I think you said you'll have it open as well. But if there's anything pressing, I'll go ahead and interrupt you. But for questions, we'll have question sections and breaks throughout the presentation, if I remember correctly. So thank you very much, and I will go ahead and pass it over to you.
All right, awesome. Thank you, Mike. Well, thank you so much for joining the call this morning. It is a Saturday, so I appreciate you taking the time. I know it's your weekend. It's a valuable time to take some time off. But yeah, so let's go over a little bit about health and wellness and how you can really make an impact in what you all do as athletic trainers, but also just in the industrial setting overall. So just want to touch a little bit again on my background. Mike gave a great introduction about me, so thank you so much. Just want to add, I really didn't think I was going to get to where I'm at in my career. It was really a unique pivot that I took. I started off doing ergonomics for Delta, then went over to OSHA compliance work and then FAA regulations within Delta. And then shifted over into global benefits and health and wellness programming. So it was definitely a unique journey to where I got to, but it has really given me a path to look at from a big picture lens and really strategize in how you approach different methods. So I'm really excited to talk to you all today on how you guys can really make an impact with what you guys do as clinicians, as athletic trainers within your guys' settings. So just want to go over quickly discrimination disclosure statements. The Industrial Athletic Training Society does not discriminate on basis of race, color, national origin, religion, sex, disability, military status, sexual orientation, or age. The Industrial Athletic Trainer Society is committed to an accessibility and non-discrimination in all aspects of its continuing education activities. Participants who have special needs are encouraged to contact program organizers so that all reasonable efforts to accommodate these needs can be made. So if you have any, situations that you might have currently, just reach out to Mike on the chat, and he can definitely help you out from there. I'm not paid for this presentation, and there's no conflicts of interest. All right, so let's jump into this. So looking at the objectives, this was listed out on the syllabus that was sent out. We're going to review and discuss the terminologies of health and wellness and the differences of the terminologies of what health, wellness, but also what well-being means. Interchangeably, a lot of people utilize the word wellness and well-being. So I want to distinguish what the difference is within what we do at Delta Airlines. We're going to identify some key stakeholders and partners within your organization to develop strategies to employee health and wellness. Sorry for the typo right there. Understand the 4 pillars of wellness and their impact on workplace injuries. Examine the type of health benefit plans and reward programs provided to your employers. And then we're also going to analyze the techniques for translating wellness initiatives into really measurable performance. So how do you make sure that you're showing your value, and how do you make sure that you are translating that into numerical numbers that you can provide to your employer on your type of engagement or the improvements that you're making. So I want to start off by doing a little engagement already. So if you guys can just drop in the chat what type of setting you work on, whether that's aviation, manufacturing, things of that, and then also what company you work for, because I want to just get a gauge of where you guys work, so I can maybe tailor some of the talking points to where you guys potentially work. So if you guys can drop that in the chat for me, I appreciate that. So do that while I'm speaking. I'm gonna make sure, just in the sense of time, that I have a lot to cover. So we're going to start off by occupational health. Occupational health and the definition of it, what are we aiming to do? Our goal is to really create a safe and healthy work environment for our employers that promote well-being for, all encompassing individuals that you might encounter. You're trying to reduce injury risks. You're trying to, enhance overall productivity. You're trying to decrease any potential diseases they might have, and just overall promoting that healthy work environment. So what do you do as an athletic trainer? What are your expertise? And I'm sure you guys already know this, but just going to go over it. Athletic trainers are those healthcare providers with specialized training in injury prevention, rehabilitation, emergency care, and really just making well suited for the industrial setting. Work settings that you guys are typing right now: construction, you got warehouse, you got safety consulting and ergonomics. Who else? Food manufacturing, that's an interesting one. Warehouse distribution, utilities, aerospace manufacturing. Oh, we actually have someone at occupational health at Delta. Awesome. Yeah, so we have a variety of different areas that you guys work in. And so you really tailor your skills to those environments, and really understanding just the industry, because each industry has their different requirements. But we have the basic foundation of what we do as athletic trainers to provide that care necessary. What is our impact as athletic trainers in the workplace? We got injury prevention. ATs help prevent injuries by educating employees on proper ergonomic practices, conducting ergonomic evaluations, and really just designing the injury prevention program overall. OSHA estimates that about 85% of workplace injuries are chronic or overuse in nature. And so athletic trainers are skilled to really treat those and prevent those injuries from occurring, and then even developing into long-term health issues that might come about for workers. When you talk about underlying, injuries, oftentimes within what I do at Delta, we focus a lot on, what are the distractions that we have? What really brought curiosity for me was really starting off within that safety realm and understanding, okay, well, what is that distraction? And then the pandemic happened. A lot of those things were highlighted to me personally, to really take a deeper dive into what the correlation is between wellness and an underlying cause with that to what an injury sustainability ratio is. And so we did a lot of correlation work within Delta, and understood that there are significant impacts of what happens within your mental health or your physical health that are going to impact potentially an on the job injury. So start thinking about those areas when I'm doing this presentation, to see if a lot of these correlations might be impacting to, what are the metrics that you're trying to be upheld by within your organization. Cost reduction is another one. Companies that employ athletic trainers report a decrease in costs associated with workplace injuries by more than 50%. So with every dollar spent for an athletic trainer, companies are seeing a return of about $3 to $7. So these are markers that you want to start understanding and really taking a deeper dive into, and also asking questions. What is the benefit of me being there, and how can I make an impact on those financial markers? This is a study in Australia, but there was significant economic benefits of workplace health management, including a 56% reduction in injury cost management, and 46% drop in compensation claims, and 68% reduction in time to return to work post-injury. So that's a lot of impact that you guys are making as athletic trainers, and those are showing by numbers. Enhance productivity by preventing these injuries and promoting that overall wellness for an employer. Athletic trainers contribute to increased employee productivity and reduce absenteeism. That's a big one for organizations. They want to see that your employers are not having lost work days, and they're being the most productive that they can. What we talk about at Delta, we have a phrase, employees are powered by wellness. That's a key catchphrase that we utilize a lot. We want to make sure that we have those foundational programs in place, so when employees are in need or they need that support, that is going to be easy for them to navigate through. And so throughout this presentation, I really want to allow you guys to do a little research within your organization to see what resources are available, what maybe is not available, and how can I really pitch this to an organization to say, hey, this is really going to be impactful for our employees, and I think you guys should make an investment to it to have an ROI to XYZ, right? And then rehab services and emergency care. I'm sure you guys are well aware of it. You guys do a lot of rehabilitation work to return employees to work, whether that's non-work related, healthy posture education, or even just minor injury management. And then emergency care. Hopefully, you guys don't have to deal with too many of those, but athletic trainers are obviously trained to provide emergency health care for any worker that might sustain a workplace injury. And then the impact of wellness programs on athletic trainers. I'll go a little bit deeper into this on a couple of the other slides after this, but we really want to increase efficiency and effectiveness. We also want to drive initiatives by data. We also want to collaborate with other professionals. So within wellness programs, you're typically involving a lot of multidisciplinary, teams, whether that's, another health professional, which is like a nutritionist, a mental health professional, occupational therapist. You're really looking at it from a holistic lens and understanding how can you collaborate with these people to drive employee culture change and behavior change. Another area we focus on is employee engagement. How do you drive engagement? How do you drive, incentivized activities? How do you strategize on that engagement, whether that's partnering with your leaders, whether that's partnering with, other healthcare providers? How do you lead to those better outcomes and those health outcomes by utilizing these resources? And then ongoing education and training, wellness programs often, you provide continuous education, whether that's, mental health resources, whether that's, a physical activity that you might do in a campaign. There's a lot of different ways that you can do a lot of trainings and educations. So now diving into what is health and wellness. So just want to give a brief definition. According to the WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease of infirmity. Touching on wellness and well-being before I go into the pillars and a little bit of the holistic approach. Wellness from our lens at Delta, what we utilize the terminology is for any type of condition management. Condition management is anything along the lines of, are you dealing with hypertension? Are you dealing with, diabetes management? Things of that nature. We gear towards the terminology wellness. Well-being, we look from that holistic lens. How are we looking at the overall day-to-day of an employee, and how can we change behavior? How can we make sure we can integrate, wellness, even wellness programs into a day-to-day to encompass well-being? So when I personally use, the terminology well-being, it's really looking at the big picture lens of an individual's overall journey. At Delta, we talk about, how do you eat well? How do you rest well? How do you connect well with people? We use those terminologies to tie that with well-being. So that is what I utilize the terminology well-being. If you look up the terminologies wellness and well-being, they're very much alike. So it may depend on, what your organization wants to utilize. We started off utilizing the terminology well-being at Delta, and then we shifted back to wellness because it just resonated a lot more with our employees. So that might be something you might face as well within your organization. But again, that's feedback. You want to make sure that you're gaining feedback from employees to understand what resonates with them. So going into the 4 pillars that I want to focus on is physical wellness, emotional wellness, social wellness, and financial wellness. So just quickly, briefly going over wellness, the 4 pillars. Physical wellness, it involves maintaining a healthy body through regular exercise, balanced nutrition, adequate sleep, and just looking at even preventative measures. Emotional wellness, sometimes even called mental wellness, encompasses really that emotional, psychological portion of it, even combination a little bit with the social wellness programs, but it affects how an individual thinks or feels and acts. Social wellness relates to one's ability to form satisfying interpersonal relationships, so with other people. So how do you adapt comfortably in different social situations, and how do you engage with people? Financial wellness is really involving one's financial resources to achieve financial security and reduce that stress that you might be having. So whether that's looking at budgeting, saving, planning for financial futures that you might have, whether that's buying a house or buying a car or investing, those are areas that financial wellness programs can dive deep into. So looking at the holistic approach and the importance of it, it involves integrating a proactive approach to maintain and improve physical, mental, social, and financial health into the everyday life to achieve that overall well-being. So going back to that definition of overall well-being, it's that behavior change. How do you build culture? How do you build those day-to-day things where it's now integrated into your life and you don't have to think about it? Having that holistic approach is really important. But then also, how do you proactively manage health? Encourage individuals to take those active roles in managing their health, which can lead to improved quality of life and longevity. And then lastly is workplace integration. So integrating health and wellness into those workplace communities can foster a culture of health that benefits both employers and employees by promoting long-term well-being and productivity. And so now I'm going to talk about why health and wellness is important in the workplace. So the 4 areas that I'm going to touch on is your economic impact and reduction in health costs. We're going to talk about improved employee productivity, enhanced employee morale, and then reduction of that financial stress that might be upon individuals. So talking about reduction of healthcare cost, comprehensive wellness programs can really lead to a significant reduction in healthcare costs of both, the employer and the employee. Like I mentioned earlier, for every dollar spent on a wellness program, companies can save approximately $3.27 in medical costs and $2.73 in absenteeism costs. And I bring this up because it's really important to partner with individuals within your organization to really nail down what are the areas that they're trying to even focus on, and also drive, financial markers in. Because at one point at Delta, we were really focusing on more so workplace culture, and finance was really not an issue. The pandemic hit, and then it became obviously a different priority. We really were nailing down on, financial numbers to understand where can we save costs, but then also still drive change. So then it was a two-pronged thing. Our strategy needed to make sure that it was aligned with both areas. So as an athletic trainer, your day-to-day may be a clinician and really looking at, what can I do at that moment in time, but start to branch out and strategize with your key stakeholders, whether that's, I'll talk about this a bit later on partnerships, but, your safety managers, your HR managers, have those conversations with them and start asking questions. Understand what their goals are so you can understand how you can make an impact on those numbers. That will show your value, and that will continue to progress within your career and help you leverage, those financial numbers that you've made an impact in, and you're able to talk about those during interviews. So try to look at those as, leverage points that you can kind of insert yourself and make those changes. So now I'm going to talk about employee productivity. So healthy employers are more productive and obviously have lower rates of absenteeism. So how do you make those changes? Studies have shown that workplace wellness programs can result in 28% of reduction in sick leave and 30% of reduction in workers' compensation and disabilities management claims costs. Again, this is another avenue that you can, tap yourself into. Partner with your HR, partnerships to understand, hey, what does our disability management costs look like? Where, what does workers' compensation look like? Can we implement a transitional duty program? Can we, integrate wellness programs to ensure that we're reducing costs on, whether, the healthcare cost is more on diabetes or cancer treatments, doing more preventative screenings. There's different avenues that you can take within those wellness programs to make sure that you're reducing those areas within, sick leave, healthcare costs, and those worker compensation costs. And then enhanced employee work morale and retention. So employees who feel their employers really care about them and their well-being are really more likely to have high job satisfaction and loyalty, leading to a better retention rate. There was a study done by Willis Towers Watson. Companies with highly effective wellness programs reported 50% lower voluntary turnover rate. So that's obviously a great thing. You don't want employers to leave. You want to, develop great leaders and retain those leaders. Also, in the Society of Human Resource Management, reports have shown that wellness programs can reduce turnover rates by 28%. So maintaining those leaders, you want to make sure that you're providing the utmost support for your employees to be able to flourish in their environment and perform in their best manners. Financial stress and reduction. Financial wellness programs can help employees manage their finances better, leading to reduced stress and increased focus and productivity at work. So these are a quick synopsis of just quick, statistics of why health and wellness programs are important. So now we can delve into a little bit of, partnerships and stakeholders. Before I get into that, I have another question for you guys. In what ways have you as an athletic trainer already supported health and wellness efforts? So if you guys can drop that in the chat. Sleep, nutrition, mobility education. I love that you mentioned sleep, because I think sleep programs are one that gets kind of pushed on the back burner often because you can't see a significant return on investment right away. But I'm really glad to hear that. Encourage employees to use their benefits like massage. That's another great one. Education about general health. Created a running 8-week nutrition challenge. Awesome. That's great. Challenges are the best way to gain engagement because it brings that excitement, brings that community aspect, but then it also has the benefit of having the wellness program. All right. While you guys type that, I'm going to start talking about partnerships and stakeholders. So I mentioned this briefly in the other slide, but really being effective with your health and wellness programs really involves you as an athletic trainer partnering and building those relationships with these key stakeholders to ensure that there's a comprehensive approach to overall employee health and wellness. You really want to leverage that to, get those combined expertise of various professionals to create and implement an effective wellness program that prevents, injuries, promotes health, but overall workplace productivity. Large companies like, Delta, Amazon, Boeing, Ford, Exxon, a lot of those companies obviously have athletic trainers, but there's standing partnerships that they have with, whether it's their safety team, whether that's their HR team, and making sure that you have that core, the combined, teamwork is really important to reduce an overall goal that you're trying to meet as an organization. The benefits, of working with these partners, you got your safety managers, benefits managers, HR managers, you got your operational leaders, you got your administrative teams, and even any healthcare or other providers that you might be working with, whether that's a physician, whether that's, a mental health provider. It's important to network with these people to understand what their overall goals are, because oftentimes you don't need to just duplicate the effort. You can really just work as a cohesive unit to make sure that you can drive that change and get to that goal. I think we got a couple others. Lunch and learn on fitness, lunch and learn topics, seasonal nutrition, biomechanics, monthly wellness topic discussed in the morning. That's a great one. Use of benefits. Okay, awesome. Thank you so much for sharing these, guys. Yeah, it looks like you guys already have some good foundational work already in place. So the benefits of these collaborations. So holistic health and safety culture, you want to build a partnership with these, safety managers or individuals that can lead more of that holistic lens of health and safety. And I'll talk a little bit about culture after this, but safety managers focus on creating safety work environments. As athletic trainers, you specialize in injury prevention and management. So how do you make sure you marinate those two together to then work as a cohesive unit. How do you build culture? It's by changing employee behavior. And I think you all as athletic trainers engage with your employees the most compared to other employees. And so I think it's really important to be able to be that driver to influence that employee to take a certain action, whether that's incentivizing them through, explaining to them, someone talked about knowing their benefits. Do you get rewards for doing certain, health activities? How do you change, engagement processes? That's partnering again with your key stakeholders to understand what is the capabilities, what is the financial markers that are able to be met, what funding is able to be met as well. So really working cohesively will be able to change that culture too. Comprehensive employee support. So collaborating with benefits managers will allows for development of wellness programs that cover a broad spectrum of health needs. There was a study by the NATA done that said organizations that employ athletic trainers see a 20 to 30% reduction in health insurance claims related to MSK injuries. So now what can we do to take that a step further, right? The research talks about MSK, but also what areas can we as athletic trainers make an impact in? With our background, I think it's really crucial and it's important to talk about even mental health. What can we make an impact within that space too? Just breaking that barrier of mental health, that stigma of mental health could already be another area that us as clinicians can really take a deeper dive into. At Delta, we partner with our athletic trainers within our clinics, in our occupational health clinics, and we train them in different avenues within mental health to then have those conversations that might come about whenever they're having those evaluations with them, whether, they sustain this injury because they were distracted by something that happened at home, whether that's like a financial burden or maybe a death in a family, you never know. Having those conversations as clinicians will be important. So, providing those training as an employer is important as well. So that ties into effective training and compliance. Partner with your HR managers. What trainings are also already available to you as an employee, but also, other individuals within your organizations. A study has shown that, training programs developed and delivered by athletic trainers can improve compliance with safety regulations up to 40%. So you already have an impact within the safety space. How can you make an impact in the health and wellness space? Partner with those HR partners, because usually there's already, trainings that are built in place, and maybe you can enhance that by this, by your educational foundation, but even your experience that you have as an athletic trainer. Streamline operations and productivity. Research indicates that workplaces with active wellness programs report a 25% decrease in absenteeism and 15% productivity. So really making an impact with that operational manager. What are their goals? How can you enhance their workplace efficiency by building in these programs? That's, again, another way to get buy-in from your operational leaders and get support within those avenues. And then enhance employee engagement and retention. We touched on this a little bit earlier, but you want to make sure that you're doing engagement programs to ensure that your people are feeling in a social connection. They feel like they're collaborating with you. Leverage your SMEs as well, your subject matter experts within your entity. Within your organization, you might have people that specialize in different avenues. So leverage those partnerships to build different engagements, whether that's a lunch and learn, like you guys mentioned, whether it's monthly topics that you might have. Make sure those are collaborated together and make a cohesive unit. So now I'm going to briefly touch on building a healthy employee culture. And this is a unique way to talk about mental health, but I thought it was really interesting how one of my managing directors talked about this. She talks about crisis and languishing. So prior to the pandemic in 2019 to around the pandemic from 2019 to 2021, we were really in that crisis mode, right? When the pandemic hit, we were like, there's so much going on. People were having, mental health crises and spikes in, attention to mental health. We were really able to build a foundation, as, overall within, everyone that was dealing with the pandemic. We focused on how do you build a foundation of mental health support and provide access to our people, and just having that capability of user access was just the key priority in that standpoint. We were just trying to manage and just start off in building that infrastructure. But now we've shifted into something called languishing from 2023 into now. It's this new norm. We're in this steady state of just keeping moving forward. You're just trying to keep going and going. But knowing that you do still have mental health concerns that are existent within the world that we live in, whether that's yourself or whether that's your employee or whomever. I hate to say this, but it's kind of that feeling of just blah, right? You're just kind of just coasting and you're just going. But how do you get out of that languishing state is really what, I think you guys should also focus on as clinicians, as athletic trainers, is how do you drive that change and how do you drive that behavior change from an employee now? So I want to focus on these three things. So safety first always. I think that's, top of mind already to, anyone within, workplace safety. And also as athletic trainers is you're really trying to build that culture of safety and emphasize safety. But then that next step is creating that sense of control for an employee. How do you do that? Within wellness, there was one research that I want to touch on is about really how you look at stress and how stress management works. So there's a researcher, Dr. McGonigal. She's a researcher at Stanford University, and she really wanted to take a deeper dive into stress because when you look at stress, you think about it just making you sick, right? Oftentimes when you're stressed, you're like, oh, well, this is going to bring me into, the common cold, or, I'm going to have cardiovascular disease from, different risk factors that might come about from stress. But she said, well, but what if, you looked at stress differently? Maybe does it have a change? So in this study that she looked at, there was about 30,000 adults over an 8-period span. And there was 2 questions that were asked. How much stress have you experienced in the last year? And then, do you believe that stress is harmful for your health? So throughout this study, people that experienced a lot of stress had a 43% risk of dying. But that was only true for those people that actually thought that stress is harmful for your health. People that actually had a lot of stress but did not view stress as harmful for you were actually no more likely to die. They actually had the lowest risk of dying within the study. And that even included people that had like little to no stress at all. So she said, okay, well, let's take this a step further. She did a social stress test. It's a test where they're creating different pressures during the study to make you feel flustered. So, when you're feeling flustered, you're going to start sweating, you're going to feel anxious, you're going to, have those different responses. Oftentimes when you think of those responses are, stress factors that you're getting a little worked up. And so she said, okay, well, what happens if you tell someone before the study that, stress, look at these factors as it's actually helping you overcome those responses and those different situations that, may be stressful to you. So with that mindset and knowing that stressful is actually a benefit to you, she did the study again. When participants looked at that, there was actually a different response to their physical, their cardiovascular system. And so they saw that your blood vessel actually stayed relaxed, which within that parameter of that study, while they were going through that response state, which obviously was different for the people that were in the first category when, they didn't think stress was, great for you, then their, blood vessels were constricting. So it just goes to show that how you view stress can really, change from you, having a heart attack or living till you're 90. And I know that's a very, blown up proportion, but how you really just look at stress can really build you that sense of control. And that's why I really wanted to bring that study up, is just perception in your mindset can definitely have a, physical change to how, your body is reacting. And so lastly, I want to touch on, or before I get into that, actually touch on psychological safety. Psychological safety is another area that, is really new, I think. And I think it started really and got highlighted more once we came out of the pandemic. So just to kind of read the definition, a shared belief that members of a team are included, feel safe to learn, contribute, and challenge the status quo without fear of being embarrassed, marginalized, or punished in some way. Psychological safety shapes the learning behavior of group and in turn affects team performance and therefore organizational performance. So let that marinate, kind of think about that a little bit. I'll touch on it in another question later. So now I want to talk about burnout. And this is encompassed with, the whole employee culture aspect. So if you look at this chart, and I like to share this chart because it's really simple to understand. You got your high engagement, you got your low engagement, low burnout, high burnout. Very oftentimes you see everyone in that tired champion area where you got high engagement and high burnout. Very, very often, but little to none do I, very, very often I see the tired champion, little to none do I see the champions, where you have the high engagement, but the low burnout. It's very rare that you're going to find someone that's so, happy about their job and they're being able to manage not being burnt out, because they're obviously involved a lot, but, they built some technique. But the red zone, those are people that are really in that high burnout, that low engagement. If you're ever having, conversation with them, those are the people that are rolling your eyes at you. Like if you're trying to, do an assessment, they're like, oh, I already know what's going on. And they're those grumpy people, right? And then you got your coasters. They're not connected to the work that they're doing. They're not burnt out. So again, like I said, you really see those tired champions. And how do you really make them feel engaged more and help them get back to the, whether that's, the champion area, but teetering between those? How do you make sure you get them out of that tired champion? Is really building culture and making sure that you can have them feel safe, have a sense of control, but then also have that sense of belonging. And so that's the last one I want to touch on. Provide a sense of belonging. When you provide a sense of belonging, you provide community. You're having those shared experiences. And how do you really support that? Within what we do at Delta, we have different resource groups. We have business resource groups that, span from, more like, what we have organizations called Fusion, where talk about Asian culture. You have different other ones that really focus on how do you get networked within your organization. We even have peer-to-peer assistance groups that focus on different tough times and challenges you might have gone through, whether that's losing a loved one or losing someone to cancer. Maybe you're going through a certain situation. We have peer-to-peer assistance programs for those areas. So build that sense of belonging. You can also do even engagement events, build communities within those engagements, whether that's just divisional, whether that's organizational. You can drive that as clinicians and drive that as an initiative of, hey, we're trying to drive safety. We're trying to drive injury prevention. We're trying to drive overall wellness for someone. But then how do you incorporate that sense of belonging? So think about these three key aspects of how to drive also employee culture when you guys are working within your organizations. So moving right along, we're going to touch on the 4 pillars. So I'm going to start off with emotional wellness. Emotional wellness involves managing stress, understanding resilience, and practicing self-culture and maintain emotional balance. So what is our goal here? We really want to support them in 4 key components that I like to hone in on: mental health support, stress management, self-care, and resiliency. And as I talk through this, think through for yourself. Do we have these different programs within our organizations, or am I just not aware of them? If you're not aware of them, start jotting some of these down, and you can actually ask these questions to, whether that's your operational leaders, which is your HR managers, your safety managers. They should know all of this within the organization that you might work for. They might have these different resources available that you just may not be aware of. Starting off with mental health support. Counseling services is a big one. Providing any type of mental health counseling support, whether that's an EAP program, or even what's it called, reimbursement type program. There's organizations that do that. What's the benefit of this? Access to those mental health support really helps employees address and manage mental health issues. employees who have mental health services report a 40% improvement in overall well-being. So that's a big number, 40% of improvement in their overall well-being. Numbers have spiked, obviously, since the pandemic on how much mental health support is needed for employees or just overall individuals in our community. And so I think this is a great way to leverage potentially that is something that's already within your organization. At Delta, we have on-site coaches, we have virtual care as well. We have, a therapy, we have therapy sessions, but then we also have something called coaching sessions. Coaching sessions are more goal setting. So it may not be talking about a challenge that you might be having, within your family, but it's more so, hey, I want to make a change in my life with XYZ, whether that's a financial goal, whether that's a career goal. There's different avenues to support within mental health. We also provide personalized care. So whether that's taking a short assessment and really understanding what the long-term goals are needed for an employee, those are avenues you can make sure you specialize in for the provider. Diverse populations as well. We have different providers from different experiences, spans of life, different specialties, genders, ethnicities, languages. And then we also even do something for leaders. We do escalation processes that really create more support for operational leaders. And so I think that's all another avenue where, as a clinician, as an athletic trainer, when you are engaging with your employees, how do you make sure that you're also supporting your leadership team to make sure they feel support from your end as a clinician? You definitely are supporting within your expertise as an athletic trainer, but then also how can you support them from that mental health standpoint? Stress management is the next one. Stress management, usually we encompass different workshops, training programs. You can teach them different techniques such as mindfulness, meditation, time management, all avenues that you can explore. Employees who participate in stress management programs report a 25% reduction in perceived stress levels. So great measures there. Reducing stress levels are going to reduce reductions. It might reduce fatigue. It can impact a lot of what you guys already take a look at. So definitely a great area to explore. What we do at Delta, we work with different, clinical leaders to talk about, mindfulness practices that might be able to be integrated onto day-to-day. So talking about overall well-being, we partner with our, local health clinics on making sure that they're talking about our resources on stress management, whether that's a wellness program we might have or a technique that might have been taught during a workshop that we have. Self-care initiatives, promoting self-care exercises to exercise emotional wellness. So whether you have a program that has a library of them, you want to be able to promote those activities to then allow individuals to practice on their day-to-day. How do I manage my stress? How do I manage my anxiety? Or how do I avoid burnout? Or do I do a mindfulness practice every day? I have a coworker, she actually is on our team, and she steps away every day after work, and she sits in this corner. And I had to ask her one day, I'm like, why do you sit in this corner every single week, every single day after work? And she said, well, this is my time to take a mindfulness moment for myself. I had a busy day at work, and then from there, I'm going home to my kids. I don't have time to take a break. And so this is my way of just taking a breather and just regrouping. And I thought that was really interesting. And I thought that was a really unique technique. And so understanding those different self-care activities can really make an impact on someone's overall health and how they approach their day-to-day. So that was an interesting self-care activity that one of my coworkers does. Resiliency. Offering resiliency training programs can really focus on how to just even build that resiliency. How do you bounce back from those setbacks or just adversaries that might come up? Or, how do you adapt to even change? I'm sure within operations, change happens a lot. And so how do you make sure that you're able to overcome those situations? And so employees really who focus and undergo resiliency training are just better equipped to those handling stress factors. Organizations that implement these programs see a 30% improvement in employee adaptability and 25% reduction in stress-related absenteeism. So, whether that's really focusing on how to, reframe those thoughts, right? So if someone is approaching you with a challenge, how do you look at that as a good thing instead of a stressful manner? This kind of ties into, how do you frame your thoughts about stress, right? How you approach different situations and how you look at them can be very unique and may change someone's approach to emotional wellness. So I may not have time for this. I might go back to this at the very end. I just want to make sure that I have time to go over my slides.
I'm Danny. I've lived with.
But that video will go over mental health first aid practice. A lot of individuals within the athletic training field are slowly, getting trained within that. What it really does is allows a clinician or any individual really to be able to break that barrier and know how to have those awkward conversations with an employee or an individual. When someone talks to you and says, hey, I'm not doing okay, how do you approach that conversation? So I'll go back to that if we have time on the end. If not, I'll definitely make sure to share that link with you guys. Physical wellness. So physical wellness is a crucial component to, overall wellness programs in the workplace, especially within the industrial setting. I think you guys are very much a, physical, mindset to what you guys do in injury prevention and things of that matter, ergonomics. You want to, you guys specialize in this area. So key components: physical activity, nutrition, sleep, preventative health care. Exercise programs, whether that's a group fitness class that your employer can provide, a yoga session, walking club, even if it's a implemented program where you have to you get a reduced fee for gym memberships, whatever it might be. It really helps to reduce any type of risk of chronic disease, cardiovascular health, just even boost moods all the time, or enhance overall physical wellness. So at Delta, what we have is we have programs that provide a discounted rate for gym memberships. We have a digital platform that provides home exercises. We have personal trainers, we have massage therapists, and we have different activity challenges to then build that community aspect, right? We talked about how do you build culture and how do you build engagement. That's how we do it, by making sure that we incentivize those different challenges. Nutrition. So healthy eating initiatives, whether that's, providing access to healthy food options within the workplace, healthy snacks, meals, but then also that education portion. How do you educate employees to have that balanced diet, having proper nutritional aspects to really leverage more energy within their day-to-day? How do they improve their cognitive function? How do they improve their performance at work? Within Delta, what we currently have been doing a lot is our food footprint. This is an avenue as an athletic trainer. We do have a background in, nutrition. How can you make an impact in the healthy foods that are provided within your environment? Oftentimes when you look at employee settings, you see vending machines. You look at the vending machine and probably unhealthy food. So what we're doing at Delta is we're really taking a look at what we're providing our employees within our cafeterias, what we provide them within those vending machines, but then also how do we make those affordable and equitable for our employees. So it's a lot of back end work with our HR managers, our supply chain managers, but even our athletic trainers help us out with that. They're out in the operation and they see all of this happening, and so they give us consistent feedback on what our employers are talking about. So that's an area that you can definitely make an impact with how your employees are provided within that nutritional space. Sleep. I know that we had one or two people talk about sleep, so really was happy about this. Educating employees about the importance of sleep and providing resources to improve sleep is really crucial. And what we do at Delta, we do have different cognitive therapy programs. We have programs that can test for sleep apnea. We can treat for sleep apnea, and this is all intertwined with our health benefits. So, providing, having adequate sleep is essential to physical and mental health, reducing risk of fatigue, related errors, and improving overall productivity. So I think that should probably hit home to you guys. Reducing risk of fatigue related errors. It's a lot of what happens within injury prevention. You want to make sure you can reduce that. So sleep is definitely an area that can be invested to prevent a ripple effect to those avenues. Preventative health measures, providing even just health screenings, whether that's, a vaccination clinic, even just blood pressure screenings. Oftentimes people just don't get their health checkups. And so this is a great way to identify if there's any early detection needed for a health issue or a risk of disease. And so whether that's, partnering with your local, hospital systems to stand up, say like a mobile mammography, a skin cancer event, you guys are aware of those partnerships within your entity. And so as a clinician, I think you need to leverage your expertise within those fields to take a deeper dive into that. So, hypertension management, diabetes management, there's a plethora of different areas that you can go in within that preventative health space. Next is financial wellness. I think we have 15 minutes. So let me zip through some of this because we still have about 6 or 7 more slides. Financial wellness looks to improve how we achieve financial stability, improve overall health and productivity and job satisfaction. The terminology total rewards. I'm not sure if you guys have heard this or, talked about it. It could mean something different within each organization, but total rewards usually encompasses anything from compensation to, your health benefits, to your wellness programs, to retirement, to disability. And so really understanding what total rewards means within your organization will be probably beneficial for you. So ask your HR partners what total rewards means to your organization. And if you can make an impact on what that total rewards is, will really define, what areas that you can really take a deeper dive into as an impact. So looking at the key components of the financial wellness standpoint, financial education, retirement planning, debt management, emergency saving, all of them kind of intertwine with each other. Financial education, understand, what's offered for my employees, workshops, seminars, is there, partnerships within our 401k management provider? Do they, have seminars that our employees can, utilize for financial literacy? Employees who participate in these type of educations are 20% more likely to feel more confident about managing their finance. So you can reduce financial stress and improve overall mental well-being. You can improve distractions from, your workplace. There's also another study that showed 83% of employers found that financial education programs improved employee financial literacy, can lead again to individuals being more focused and productive in the workplace. Retirement plans, understand, what are the 401k benefits that my organization is providing and even providing matches. It just provides access to employees with the 50% more likely to save for retirement if you do have a program for set to retire. A study by Fidelity found that employees who participate in a retirement planning program save an average of 15% more for retirement, leading to reduced financial anxiety about that future. A lot of individuals always are stressed about the future, so a great way to make sure that you can make improvements. Emergency savings is a great one. At Delta, we have created an emergency savings program where we require individuals to lean into financial literacy and go through a program, and then also build behavior change to make sure they're investing into their emergency savings for them to achieve the incentivized amount that we provide for them. So a great way that you can then motivate your employees by getting those financial markers through your HR partners, and then making sure that they can make an impact onto their overall mental well-being. So again, everything has a ripple effect on the programs that you have to even just the different pillars that we talked about previously. And then the fourth pillar is, if this goes, social wellness. Social wellness really involves that sense of connection. So we talked about sense of belonging, so really tied into that. How do you build that support system? Key components here: team building activities, connections and supportive work environments, and community involvement. Team building activities, they may not pertain specifically to you guys, but how can you make an impact with your partnerships and your key stakeholders to create different engagements, workshops, retreats, social gatherings At Delta, we have large events throughout the organizations, even divisionally, to make sure that we build a sense of belonging within our organization. We build that community and family aspect to make sure that we can build those connections. Within that supportive and work environment, I talked about the business resource groups. We have, LGBTQ plus communities. We have multi-generational workforce communities. We have a community called SHE. It's about women in the work environment. And then the peer support groups I mentioned earlier as well. How do you stop the stigma and support those who lost a loved one? We have one about, support for miscarriage or infant loss called Hope Springs. So really unique ways to make sure that you can build that sense of community for individuals within that social wellness program. Community involvement gives employees a sense of purpose and fulfillment. Employees who participate in volunteer activities are 2.5 times more likely to feel proud of their company. So again, that goes into ripple effects. If someone's proud of their company and they're enjoying the work that they're doing, they're feeling connected. That goes back to that burnout diagram I gave you. How do you make sure you're building employees and encouraging employees to feel connected in the work that they're doing? So that's a great statistic that goes back to that burnout. So I want to ask you guys a question. So I know we touched on this a little bit earlier. So with that being said, with all the 4 pillars and talking about psychological safety, what does psychological safety mean to you guys? If you guys want to drop that in the chat, after kind of going over these 4 pillars, talking about the definition, how does it resonate to you? And there's no right or wrong answer here. It's really how you look at it. And maybe you can even tie in, how can you make an impact potentially in your current organization and see what different avenues that you can take. And then I'm going to skip through this because I know we only have 2 more minutes. Engagement, be that connector. Partner with your stakeholders and your leaders. Be able to understand who those stakeholders are. Create a champion network to support your promotion, whether that's a safety champion, a wellness champion. Build allies within your organization and your employees to be able to then amplify your messaging, whatever that messaging is for yourself. I know someone talked about curating monthly topics. I have that here as well. Whether that's a national month, February is Heart Month, March is Nutrition Month. Leverage those to make sure that you can be engaged more with your employees. Organize company-wide events, whether that's a health and wellness event, injury prevention event, employee appreciation event. Build an event about employee culture. Those are different areas that you're able to, make an impact and build engagements. Lastly, gather leader support. Make sure that you're really getting that buy-in from your leaders. Get sentiments and feedback from your leaders. The more you put in the asks that they're telling you, the more they're going to be engaged because they're seeing that movement and that change that you're impacting. And then lastly, I want to just quickly, I know we're at time now, but translating wellness success into KPIs. Really understand how you can show your value as an athletic trainer and the work that you're putting in. Data is really the foundation of how you're going to drive change. Partner with your HR partners, partner with your benefits managers, understand what your healthcare costs are looking like from a TPA standpoint. Look at that descriptive analytics, but then, what's happening, but then understand how you can say, why is this happening? Look at that diagnostic analytic portion of it. Also partner with your operational leaders, understand what they're even trying to achieve, what are their goals, and how can you intertwine wellness metrics into that, whether that's engagement for your different rewards programs that you might have, or even just overall engagement with, say, your champion network that you might build. Build that into a dashboard. Utilize your subject matter experts. I'm sure you may have, an analytics team that you might be able to lean on to. Have them look into the healthcare costs. What does that look like when you compare that with operational data? Look at your injury rates. What does that look like with absenteeism and lost work days? Look at your FMLA and disability. How does that correlate to your healthcare data? It drives a lot of that change, and you're able to build trends. You're able to then assume what's actually going to happen, and that can build efficiency within the operation. So I think those are areas that you can, as an athletic trainer and a clinician, seeing really that clinical side of things, now you can take it into a strategy lens. Again, reduction of claim costs, and leaders are, again, attracted to quantifiable results. They want to see numbers, and they want to see being impacted financially, or they're operational. So really take a deeper dive into understanding how you can translate a lot of what I talked about today into numbers and KPI measures for your organization. So I know that was a lot. We're right at time at 11:02. Again, I want to thank you guys for taking the time on a Saturday to tune in and to talk about health and wellness, and just learn a little bit about our pillars that we have, but then also how can you make sure that you can make that into transitional actions of what you can do as a clinician in the industrial settings. So does anyone have any questions? If you have any questions, you can drop it in the chat. If you don't feel comfortable coming off mute, if you do feel comfortable coming off mute, more than happy to answer questions if you want to come off mute.
My connection broke up right when you were talking about what your coworker does as their mental health step away. Can you recap that real quick?
Yeah. This is a practice she does for herself. She just goes into a corner of our office and she takes a chair and she just sits there, closes her eyes, and she goes through her head, and I didn't go too much in detail of this, but she talks about the good and the bad of what happened that day. She talks about the successes she had. She talks, in her head, and then she also talks about, what didn't go well, but what can I do better next time? And then reframe that thought as a chance of opportunity to make an improvement in her life. So she takes that as a time to analyze what just happened on the front end of the day. And then from there, now she can go on the back end of the day, now refreshed with a solution and a mindset that's really positive, and that has now taken what has happened, but now just kind of put it in a cabinet. She put it in a cabinet inside her head, and she said, okay, now I can go and be with my kids and now deal with my kids in a different manner. So that's the practice she does to make sure that she can divide up her day, to make sure that she's not stressed when she approaches her children, and she wants to be able to give her family the utmost attention that she can without having distractions.
Thank you.
Any other questions?
This concludes the IATS OnDemand Continuing Education Program video. To claim your CEU, you must be a member of the Industrial Athletic Trainers Society and complete the form Claim Your CEU found in the YouTube description. If you have any interest in learning more about what the Education Committee has to offer, reach out to the email address on your screen. If you would like to volunteer your time to speak on a topic that interests you, please reach out. Thank you and stay safe.